friends, welcome back to the question answer series. Our today's question is to Dr. Amit Patki. Dr. Amit Patki is a well-known figure in the field of obstetrics and gynecology, especially in fertility. He is from Mumbai and he is very well known for his work in the Lotus study on progesterone. Also, he has been the past president of Mumbai Obstetric and Gynec Society and he is the vice president of ESAR. Dr. Patki, the question to you is that many times we do semen analysis, but these days lots of people are doing sperm DNA fragmentation for semen. So please let me know what is the importance of sperm DNA fragmentation in today's practice.
Thank you, Dr. Asha Baxi, for having me in your question and answer series, which are doing very wonderful. I'm Dr. Amit Patki. DNA fragmentation is due to abnormal packaging and damage of the sperm chromatin. Normal sperm chromatin integrity is essential for normal embryo development. The sperm is susceptible to damage if the packaging with protamines is incomplete on these sperms, and this will hamper the fertilization, the early embryo development, implantation, and thereby giving us a low pregnancy rate. Unfortunately, there is no repair of the sperm that happens once it is transported to the epididymis or into the post-ejaculate sample. Now, the sperm DNA fragmentation measures the oxidative stress or the ROS, which is the reactive oxygen species on the sperms. So any condition or situation which will increase the oxidative stress, thereby increasing the ROS, will increase your sperm DNA fragmentation. There are various tests that can be done to detect the sperm DNA fragmentation, which is done on the ejaculate sample. The sperm chromatin assays, the tunnel test, the halo test, or the comet test are the frequently used tests, and all these tests have a good correlation with each other if done in a proper lab settings. In which patients do we need to do these tests? These are not to be done routinely. They are to be done in patients with male factor infertility, severe male factor infertility, particularly those with clinical palpable varicoceles, or in couples with recurrent IVF failures, with recurrent spontaneous abortions, in patients with advanced paternal age, and even in patients with congenital abnormalities. What is the treatment if the sperm DNA fragmentation is increased? The first and the foremost is to reduce the ROS, and this is done by change in the lifestyle, quit smoking, reduce weight in obese patients, treat metabolic disorders, particularly diabetes and hypertension, put patients on the oral antioxidants which will reduce the ROS. The other technique we can do is to take the sperms directly from the testicular biopsy and use them in ICSI, thereby preventing the sperm from being exposed to the increased ROS in the epididymis or in the vas. So the most important thing is that in male factor infertility or in patients who you get poor fertilizations or slow growing embryos, it is worth testing for the sperm DNA fragmentation and then treating these patients with antioxidants. But by far and large, if there is severe sperm DNA fragmentation is markedly increased, it would be better to get sperms from the testicular biopsy. Thank you.